In any case of pleural effusion, our aim is to find out what is causing that effusion, right? Whether there is inflammation related causes or non-inflammatory cause. If it is due to inflammation related, we call that exudative because there is lots of inflammatory cells in the effusion. If it is not related to inflammation, it is just due to seepage of fluid from the serum and there is not lot of cells in that effusion, we call that transudative effusion. And traditionally we have very popular criteria called Light's criteria, which utilizes protein level and LDH level in the effusion and compare with the serum level to decide whether it is exudative or whether it is transudative. You all know that. If there is a lot of inflammatory cells, due to that there is increased protein in the effusion, and cells release LDH when they die. So when there is lot of cells, inflammatory cells, then LDH and protein will be elevated in the effusion. So based on that concept, they have given this Light's criteria. But today I won't discuss about Light's criteria, but I would like to talk about glucose level. So how glucose level in the effusion will help you to differentiate the etiology. So if there is lot of inflammatory cells in the effusion, then those cells will consume glucose, and due to that glucose level in the effusion will be low. So let's take an example of either infection related inflammation like empyema or complicated parapneumonic effusion where there is lots of neutrophils. So those neutrophils consume glucose and glucose in the effusion will be low. Or whether it is due to autoimmune related inflammation like SLE, rheumatoid arthritis, where there is lot of lymphocytes which consume glucose. So there also be glucose will be low. Or malignancy, or in long malignancy there will be lot of highly active malignant cells. Those will consume glucose, and glucose in the effusion will be less than 50% of the serum glucose level. If you see transudative effusion, this is just a seepage of serum from the blood to the pleural fluid. So there the glucose level in the effusion and serum will be similar. What about pulmonary infarct related effusion? You might have seen pulmonary infarct related effusion. There if you see the protein level, LDH level, it will high and it will fall under the category of exudative effusion. But glucose level is similar to the serum level because there is not that much inflammatory cells there, right? Another condition in post CABG effusion. So after CABG, some patients develop reactive effusion, pleural effusion, which can be on either side. In that case also glucose level will be similar. Another example, in esophageal rupture, there can also be effusion. In that case, glucose level in the effusion is less than 50% of the serum. Do you know why? Because if there is esophageal content leaking into the pleural cavity, then there is lot of inflammation, right? And due to that inflammatory activity, glucose level will be low.